Hello friends, my name is Dr. Saif and today I have brought a brand new question for all of you related to ventilator waveform, and it is important for everyone who is interested in critical care medicine or who is an exam going. Alright, so let's start without wasting any time. So observe this image of two ventilator waveforms related to same mode. Above is this graph which is a pressure time curve, and the lower one is the flow time, as you know. Now first question for you is, what does this arrow represents? This is the first question for you. So here is the arrow. So what is this value represents? Okay, so this value represents what? So answer is peak inspiratory flow rate. So this is the peak inspiratory flow rate. As you know, this is the flow time scalar, and this is descending flow pattern, inspiratory flow pattern. And here there is a cycling occurring, and this is the expression, and this is your peak expiratory flow rate. And here on the positive side, this is your peak inspiratory flow rate, and this is the pressure time scalar. So this mode is, can you guess? So this mode is pressure control ventilation mode. All right, so here we have one question for you. Peak inspiratory flow decreases when? So here are the options. Now, let's discuss about the second option. The second option is set inspiratory pressure increases. So this is wrong or right? So remember, whenever there is increase in the inspiratory pressure in the pressure control ventilation mode, there will be increase in the tidal volume. And as you know, that the flow rate or flow, just simply flow, is equal to V upon T. So volume delivered in inspiratory, though this is Ti, in inspiratory time. Okay, so suppose there is an increase in the volume, there will be increase in the flow rate, and this volume in the pressure control ventilation depends on the inspiratory pressure. All right, so when there is increase in the inspiratory pressure, there will be increase in the volume, and there will be increase in the peak inspiratory flow, provided inspiratory time is constant. Okay, so this answer, so this option is wrong. Now let's discuss about the elastance. So as you know that elastance is inversely proportional to compliance. And as you know, the compliance is basically delta V upon delta. Okay, so increase in the volume per unit change in the pressure. So if there is increase in the volume, there will be improvement in the compliance or increase in the compliance. So suppose there is a decrease in the elastance, there will be increase in the compliance, and there will be increase in the volume. As you know, the flow depends on the volume. So suppose there is increase in volume for the constant pressure, as we see in the pressure control ventilation mode, there will be increase in the flow. So flow is represented as Q dot like this. So there will be increase in the flow. All right, so this option is also wrong. Coming to fourth option, which is resistance. So what is the relationship between the resistance and peak inspiratory flow? So as you know, so this is the airway, and there is the flow of air, and against the flow of air there will always be resistance. Okay, so there is a inverse relationship between the flow and resistance. So basically flow is inversely proportional to the resistance. The peak inspiratory flow should rise, so this option is also wrong. Now the last option regarding the DP. So DP is very interesting, that is your driving pressure. So as you know, this concept is used in ventilating the ARDS lungs. So what should we do in ARDS lung? We should not ventilate with large tidal volume. So our tidal volume should be low and protective. So for that purpose, after 2015, we have started using driving pressure concept. So what is driving pressure? So driving pressure is simply Vp is equal to P plat minus P. So suppose there is increase in the driving the P plat or plateau pressure, otherwise known as alveolar distending pressure. So suppose there is increase in the P plat, there will be increase in the dP. Suppose there is a decrease in the P, there will be increase in the dP. Okay, so this is the relationship between the PEEP and DP also. So suppose there is the increase in the driving pressure, what will happen? There will be increase in the tidal volume delivered. Okay, because simply it will increase the volumes. There will be increase in the, so oil will go up. So which is not happening here. So this option is also wrong. Okay, PEEP, as you know, the driving pressure is equal to PEEP flat minus PEEP. So suppose PEEP increases, so what will happen? DP will go down. Okay, suppose PEEP is increasing, this DP will go down. So suppose DP goes down, so the volume will be affected, so volume will be limited. Okay, and then this volume is limited, so the flow will also be decreasing. So peak inspiratory flow will go down. So this is basically the correct option. All right. So I have not gone into detail of each variable so much. So just to give you quick and factual interpretation of each option one by one, I have created this video, and I hope that this video will benefit to all of you. You must have a lot of questions in your mind, a lot of doubts. So please write your doubts here in the comment box. And if you have any other explanation or any other alternative, answers or alternative interpretation, then you can use the comment box below to correct me. Please like this video and share this video with all your colleagues in critical care medicine, and please spread this video to all of your friends. So that's all for today. Thank you. Bye bye.